But here in Ottawa, the premiers from all the provinces and the territories have been meeting with Justin Trudeau and the federal government to negotiate a new deal to deal with our completely dysfunctional healthcare system. It's a provincial jurisdiction, but it's an issue facing every single province and territory right now. So Trudeau has proposed a plan that would see $200 billion going to the provinces over the next decade. But it has been a bit controversial. It hasn't been immediately accepted by the provincial premiers. In fact, they have pushed back on it, saying that it was much less generous than they were expecting. They had been asking for $28 billion per year. Trudeau's promises amount to closer to $5 billion per year. So quite the discrepancy between expectations and reality. So what do you think about the deal? From what you've seen this week and the response from the premiers?
Yeah, thanks for asking, Daniel. It's not about the money. We are spending in Canada about $331 billion last year for healthcare. So, and
almost $9,000 per person per capita.
Absolutely, and it is more than a lot of other countries, Western countries. And, we are not doing very well. We are not very efficient to deliver services. Waiting times for surgeries are very long if you compare that with what is happening in Europe. So it's not only a question of money, but for the premiers, it is a question of money. And, when, a provincial government is spending about, depending on the province, but between 40% to 50% of their budget in healthcare, the system is broken. They need to implement big reform. And when I'm saying the provincial governments, it's not at the federal level. So I believe that what Trudeau did, giving more money, it's not the solution. We must push and the provinces to do more reform for having, a system that will work like in Europe, a system with a mix of private and public hospital with universal coverage. We need that. And like that, I believe it would be more efficient. But to do that, you need to give them the responsibility and asking them, we won't transfer you any more money, because the problem now, as a citizen in one province, you don't know which government to blame for the lack of services. Is it your provincial government because your government is not efficient at managing the health care system? Or is it the federal government because it's not giving enough money to your provincial government? So the way to solve that, give to the provinces the tax point, so we can give them the GST. And by the way, the GST, they will have $47 billion. And right now, the government this year will spend $45 billion only this year. The transfer coming from the federal government would be $44 billion. So giving them the way to tax their people and the responsibility, and like that, they won't be able to come back. We're going to say, you have all the revenues coming, the income coming from the GST. So deal with that. And if you want more money, you'll have to cut at another, budget in your own budget. You'll have to cut, I don't know, the transportation budget or something like that. So they will have a real discussion at the provincial level to open the system to more competition.
This whole situation, I think, really encapsulates that as the root issue. We've seen out of the 10 provinces, 7 of the 10 provinces have had surpluses, either last year or this year, last year or the previous year. But 8 out of 10 of the provinces have only increased their healthcare expenditures by less than 2%. So not even keeping up with inflation. So despite having excess money, a budget surplus, they're not even putting it towards healthcare while demanding more healthcare more transfers, more money from the feds. Which is just like, it's a bizarre situation. They have more money. Why aren't they investing it? Like, this is the root problem here is really the whole transfer system.
Absolutely.
And the politicization between the provinces. They want money without conditions, but the federal government wants to give money to get them to go in a certain direction.
Because when the federal government is giving money, that's going to the province. It's not going to a specific healthcare fund, as you know. So they can spend their money for transportation or other things. We don't know if they're spending that money for healthcare. So for a province coming to Ottawa and asking always for more, it's easy. They don't want to look and do the big reform, but the federal government also on their part, they don't have the courage to tell provinces, take the money, take the GST, don't come back and do your own reform.
Yeah.
Same thing for Pierre Poilievre. When they asked Poilievre about that deal, he said, I will respect the deal. That's it. But,
our system's completely broken. He's talking about how broken Canada is, but he has no solutions when it comes to healthcare. He just says Trudeau's got it.
Yeah, that's it. We have actually, as you know, that's not the first time that we speak about that. We at the PPC, it was part of our platform in 2019, 2021, and it will be part of our platform at the next election because we need to have that bold reform. But actually, as you may know, the Global Mail and the National Post wrote editorials saying that must be the solution. The federal government must have nothing to do in healthcare. It's under a provincial jurisdiction. And they said they must transfer tax point. Actually, they said the same thing that we said, but they didn't say, that's the position of the PPC and we have the right position and the best position for Canadians and the best policy for Canadians.
So the biggest problem is just the provincial government and the federal government pointing fingers at each other, saying it's your fault. Voters don't know whose fault it is,
and they're speaking against private delivery also. It's bad if you have private delivery. If you have private delivery, that will be the poor will go to the public hospital, the rich will go with the private hospital, the rich will have the best doctors, the poor will have the worst doctor. So private, it's bad, but that's not the case. If you have a mixed system, your doctor will have to work in the public system, in the public hospital, and he will have to work also in the private. So you have this system in Europe, and that's working. And actually, about 25% of the healthcare services in our country are done by private delivery, private clinic. So you have a part of a private system, but only around 25%. We must to open that. And we know that everybody will have an insurance and everybody will be able to have the service that they want. So let's have that real discussion. But Poilievre and Trudeau are afraid because if they're speaking about a mixed system, maybe, they don't want to explain to the population that it's the best system. No, the poor won't be able to have access. And that's BS. Sorry, that's BS.
It's one of those like sacred cow, third rail kind of topics in this country. People have this weird, it's really wrapped up in the Canadian identity, right? It's one of the things that separates us from the Americans. A lot of people Canadians are just Americans with free healthcare, right?
Yeah, but we're not supposed to have an identity. If you listen to Trudeau, we're not supposed to have one. So let's do that reform.